At 4:50 p.m. on the day of the earthquake, life was normal. Kids were coming back from school, and at 4:52, when the earthquake struck, Haiti was never going to be the same again. We don't know when these things are going to strike, and that helps inform my approach to being prepared and my vigilance. Just immediately after the earthquake, there were some images that started coming out back from Port-au-Prince area. There wasn't a lot of other hard information in terms of numbers of deaths, but we could see that there was a lot of rubble and that Port-au-Prince was essentially decimated. I knew as an epidemiologist working at CDC and also as a physician that there would be a role for me there. About 1 million people were displaced from their homes, and they moved into spontaneous encampments. Because there was no infrastructure, no plumbing, no electricity, there was a high risk for outbreaks of infectious diseases in those settings. It became clear after a couple weeks in country that there were many NGOs offering services in tent camps who were not reporting to our surveillance system. So while I thought my role was going to be analyzing data and crunching data in the evenings at the embassy and passively waiting for the reports to arrive, that I needed to actually get out into the community and visit the tent camps and educate clinical directors about the necessity to report and to gain buy-in for more reporting from camps throughout the Port-au-Prince area. That involved some creative problem-solving skills that I hadn't anticipated needing. We had t-shirts made that said "Information for Action" in Creole. We partnered with the actor Sean Penn, so we were able to get much more thorough reporting after a month in country. Being a disaster service worker is an opportunity to serve when our community needs us most. I think sometimes people worry that they may not have what it takes to make a difference in a disaster. And I think Health and Human Services workers actually have a lot built in. We work here for a reason, and we're service-oriented people by and large. We function on teams in our day-to-day life. We exhibit professionalism in our day-to-day life. We are service-oriented. We care. Those are all skills that you need to apply in a disaster setting. I've seen with my own eyes what happens when people are not prepared. I prepare because I care.